Hi, my name is Kerryn. I'm one of the dietitians of Nutrition Innovated, an associate dietetic practice in South Africa. We have just finished week 5 of our lockdown here in South Africa due to the COVID-19 pandemic, and I have been doing weekly posts as a way to give myself accountability and to make sure that I stay disciplined with my eating habits and my food choices. And I found that this has really helped. I have had a lot of people send through questions and comments asking me why I'm doing this. And I think there's a big misconception out there that trying to lose weight or keep a lean body mass is all to do with vanity and aesthetics. And I just wanted to create awareness that it's a lot more than this. And there are a lot of studies and a lot of data out there that show that people who have a higher body mass index due to having a higher body fat percentage are at a much greater risk of diseases across the board and are in a much poorer state of health. And this is something that is quite important to me and is one of the main reasons why I try and keep my body composition and my body weight in check. And the reason why this has become even more relevant now is because as dietitians, we are very much on the front line of helping to manage patients with the coronavirus. And over the last couple of weeks, we've been watching webinars to try and upskill us and make us aware of certain problems that these patients might have, especially on an ICU setting. And what's been quite interesting, the data that has been coming out of other countries very much shows a negative correlation between those patients who contract the coronavirus and who have pre-existing comorbidities like type 2 diabetes and a high body weight. So this has been quite interesting for us to look at, and what it translates to is if you are overweight and you have a high body fat percentage and then you contract the coronavirus, your outcome is likely to be worse in terms of your morbidity risk, as in how severely the disease progresses, as well as what your mortality rate is, as in all cause of death. So at this time, it's ever more pertinent to try and look after your body and try and lose the weight that you're trying to lose and to maintain a lean body mass. And one of the main things that we know, and one of the main variables that we see all the time, is that our food intake is the most important thing to consider when it comes to maintaining our body composition. Irrespective of exercise that you may or may not do, your food intake is the main variable that you should try and manage and you should try and control if you're wanting to maintain a lean body mass and control your body composition. So I really do want to encourage everyone out there to take stock of their habits, take stock of what their food choices are, what their eating habits are like, or what their eating habits have become over this time in lockdown. And we have now in South Africa extended onto a level 4, which means we are still required to stay at home. However, people are going to be moving about a little bit more, meaning that our exposure to the virus is potentially greater. So now, if not before, is even more of a time to start managing your health and really start creating and developing good eating habits and making the right food choices. So if you haven't already, please start considering this and maybe get an assessment done, have an idea of what your body composition is, as it is one thing that you can manage that will definitely down the line improve your outcome should you potentially, say, contract the coronavirus. So I'm more than happy for people to send me comments and send me questions if you would like. Otherwise, have a lovely day and enjoy your weekend. Goodbye.